we're back. Dr. Brauman joins us now on the show. Dr. Brauman, thank you for being here.
Thank you.
For the first time, our cameras were able to follow Linda throughout her day of surgery, and we were able to talk with her and get her perspective on things. What is the day of surgery like for you?
Day of surgery for me is usually the same pretty much. I get up in the morning and I'm already in the thinking and focus mode, and I come into the office and I start, and everyone knows that I should not be disturbed because I'm in my own world and my own head, and I'm concentrating, focusing on the surgery to be done.
When the patient arrives, what do you do next?
I go in there and I review the chart, review all the information. I always do that. And then I go ahead and do the marking, the planning, and really focus on what I need to do.
Dr. Brauman's going to come in this morning. He's going to look at you. He's going to look at your history and physical. He's going to go over your chart. Okay. We'll go over the areas that he's going to be marking.
The marking is pretty extensive, actually. It takes a good hour in most cases. And once this is done, the patient is gradually sedated. They go into the operating room, and they very comfortably and slowly go to sleep. And then it starts. In many patients, regardless of what I do, and especially in body contouring, I try to do a body contouring process, meaning not just a tummy tuck, but really changing the person's figure, and that involves a lot of areas and a lot of surgery, a lot of things to do. And the bottom line in all this is safety. You want to make the surgery safe, and a safe recovery is safe surgery.
And in Linda's case, we've talked with her. It's been about a week and a half since she had surgery. She's moving around. I mean, you would never even know.
She was like this 2 days later. So she was fine. And most people are fine within a couple of days. And that is the beauty of it. If you do it in such a way that a person is fine within a very short period of time, that makes it easy for the patient, but more importantly, it is safe. It's the safety issue that we come in again and again.
When did you decide to break up her surgeries into two separate components?
Oh, almost immediately. I essentially said to her, what bothers you the most? You know, in terms of your lifestyle, in terms of just what bothers you. And it boiled down to the fact that what bothered her the most was her abdomen. And that was what we tackled first, because it was clear that she needed a lot of surgery. She needed a lot of things done. And the question is, how do you deal with it? You do what is important to do first, and you take care of all these areas together so that when you're done, even with the first stage of the procedure, the person looks symmetrical, they look proportional. That's important because you don't want to leave someone after one surgery with something that looks very disproportional so that they absolutely have to have the second stage of surgery. Second stage of surgery is optional. If you want more, you can always have more, but you don't have to have it, and that's very important.
When Linda went home, she got that dramatic reaction from her coworkers and friends. She said she couldn't wait, and she's a little nervous to walk into her pub, and there were just people that were so impressed with it. It really was a dramatic makeover for her.
It is dramatic, and you cannot hide it. It's clear, and you know, with her, she was already after the weight loss, so everybody knew that she had a weight loss, and now she looks even better. So what happened? And it's clear, and and that's the beauty of it. It's dramatic, and this is the thing that makes you keep it up, because now you're encouraged, because now it's no longer unfair, now it's fair.
One thing that Linda said that has really touched her heart, she felt like she really mattered to you guys here.
And she does, because when you have a patient, and that's the nice thing about plastic surgery, and it turned out to be the nice thing, because I always thought that plastic surgery was one of those professions where you saw someone and you did what you did and that was it. But it's not so. You do create a relationship with people over the years, with them, with their family, and that is a positive. You know, it's very nice to be positively involved in someone's life. And yes, we called her to see how she was and to make sure that she was doing okay and that there were no questions and so on. And we always do that.
To hear that you have changed someone's life and just made it better, that has to be great.
Makes my day. It really does. Makes my day every time. Because how much more reward can you have for your work if you get the reward almost instantaneously? Because the next day, the day after surgery, that's it. You know, they see the work, and that's the beauty of it. So if you're a surgeon, and surgeons are usually impatient, this is the ultimate reward.
Thank you, Dr. Brauman.
Thank you.
We're going to take a look at more of your work in our before and after gallery. And also, when we come back, we'll have more on a new article Dr. Brauman just had published that's creating a lot of interest in the field of plastic surgery. We'll be right back. Thank you for joining us as we continue our discussion with our featured plastic surgeon, Dr. Daniel Brauman. Earlier, we talked about what the day of surgery is like for you. Now we're going to talk about a recent scientific article that you had published.
What it had to do with was one aspect of body contouring, which is the approach to tightening of the muscles in tummy tuck, which I thought needed a different look. And I've done the work already over the past few years, and this is one portion of my work.
Do you find that other surgeons start to kind of follow suit?
Yes, because and other surgeons may have already been thinking along the same lines, and you may have been the one to just write it out and say, this is what I think, and this is my experience. And the reports that we got, you know, from other surgeons were very positive. I mean, obviously they had their own point of view, and they added that to the response, and then the journal asks you to respond to their point of view, and that makes for a great scientific debate, because, you know, we may not all agree on the same thing, but it really brings up the topic to the limelight.
Mm-hmm. Can we address the laser lipo techniques? I know we've talked about that in previous shows.
I have seen the results. I'm not tremendously impressed because I have, you know, I know what I can do with my own technique, and it's not even an issue of technique, because laser liposuction is not a technique. It's an instrument. It's a different instrument. Liposuction is liposuction. You're just using a different instrument. And as far as I'm concerned, and I've been there before with other techniques of fat melting, it is, to me, and this is obviously my opinion, it's much more invasive, because to me it's a technique that, in my opinion, will come and go, like other fat melting techniques, and it does not offer any benefits whatsoever over what I now do.
Let's switch gears for a moment and talk about when someone has a major change to their torso area. They've had a belly tuck or liposuction, and they lose weight here, and all of a sudden a bonus result. It looks like you've had work done on your breasts. They were always there.
Yes, and it is a bonus. And the question is always whether or not, for instance, when it requires a reduction, when they're made much larger. Typically, they were large in the first place, and you knew that they were large, but you know they didn't appear as large prior to your work on the midsection. And quite often, I've had people coming in and saying, I wanted some work on my breast and my midsection. And the question is how much work there is to do. Sometimes you can combine it, sometimes you cannot, depending on what you need to do on the breast, because the different things that you do on the breast are reduction, augmentation, or uplift.
Can you go into specifics about each of those?
Yes. Just broadly speaking, when you do, if you lost the volume of your breast, and you lost especially the volume on top of the breast, on the upper portion of your breast, and you want restoration of volume, that obviously means an implant. It means breast augmentation. If your breasts are sagging, but you do have enough volume in them, that means an uplift. And so you can uplift the volume that you had and uplift the breast and restore it that way. If you're talking about having very large breasts and having too much volume in the breast, you're talking about a reduction. The interesting thing is that every reduction is at the same time an uplift also.
How many of the procedures that you perform are different than how you were doing them, say, 10 years ago? Maybe you found a better, safer, different way. Do you think all of them, most of them?
It's not 99%, it's 100%. And it's not just different from from how I started doing them. It's different from a year ago, 2 years ago, and so on. Everything evolves. You learn, you get more experienced, and you look at things differently. When you look at experience, you can look at it in two different ways. If you've had a 20 or 30 year career and you've been doing the same thing over and over and over again, that is one type of experience. But the other experience, which I think is much more substantial, is that you have evolved constantly, and you've constantly tried to look at things and make them better.
Dr. Brauman, thank you for joining us.
Thank you.
And that will do it for this edition of the World of Plastic Surgery. We thank you for joining us. We'll see you next time.